Hi everyone! This video is going to be a short overview of a prevalent condition in the United States that is diabetes mellitus, which is simply referred to as diabetes. Diabetes is a condition in which the blood in the system has a high level of glucose, a type of sugar our bodies use for energy. When the glucose in our bodies isn't being used, it starts to build up in the bloodstream. This can be detrimental to our health, which I'll go into further detail about shortly. The causes for high levels of glucose are different, depending on what type of diabetes an individual is diagnosed with, but it mainly concerns issues with insulin, a hormone your body naturally makes in the pancreas that helps move glucose into your cells to be used as energy. The causes are categorized into two major types, type 1 and type 2. For this video, we will focus on type 1 diabetes. Type 1 is a lifelong autoimmune disease that typically appears during childhood and adolescence. However, it can develop at any age. The cause as to why individuals with type 1 diabetes have a high level of glucose is because their body's immune system isn't working the way that it's supposed to. The T cells in a normal immune system attacks harmful bacteria and viruses, but the immune system of type 1 also attacks insulin-producing cells called islet cells located in the pancreas. The number of islet cells decrease in the body, and with little to none of these cells producing insulin, this causes a number of problems. For one, the glucose builds up in the bloodstream. This can cause damage to your blood vessels and increased risk for a number of complications, including heart and blood vessel problems, kidney disease, nerve damage, eye damage, and more. 2. Your body is getting no fuel from glucose, so it starts to break down fats for energy. This is a life-threatening condition known as ketoacidosis, which can kill you. In 2015, an estimated 9.4% of America's population of all ages had diabetes, which translates to 30.3 million people. This includes 1.25 million children and adults having type 1. In 2015, around 1.5 million new cases were diagnosed among American adults aged 18 and older. More than half of the cases were adults aged between 45 to 64 years. It is estimated that 40,000 cases of type 1 will be diagnosed each year. The overall trend of diabetes in the U.S. has generally increased. The number of diagnoses for type 1 and 2 diabetes have had both a steady and rapid growth over the years between 1958 to 2015. The years 1999 up until 2010 is seen to have the sharpest rise, but the number of diagnoses continued to climb up until 2015, which is the most recent year the data for diabetes has been recorded. The main risk factors for type 1 diabetes includes a family history of type 1 diabetes, environmental factors, and genetics, such as genes that produce diabetes autoantibodies in your body, which specifically destroy the islet cells. There are a number of symptoms a patient diagnosed with type 1 diabetes may experience. Those are frequent urination, increased thirst with dehydration, extreme hunger, extreme tiredness and weakness, blurry vision, irritability and other mood changes, unexplained weight loss, and high levels of sugar and urine when tested. Treatment for type 1 is focused on managing blood sugar levels, done mainly through a combination of animal or synthetic insulin injections, diet, and lifestyle changes to minimize its effects and prevent complications. There is no way to prevent type 1 diabetes, and to this day, the exact cause for type 1 diabetes is unknown. As of now, researchers have only gathered that genetics and environmental factors do play a role. Diabetes continues to be the 7th leading cause of death in the U.S. As of now, there is no cure. People with diabetes can go into remission, meaning they can go through a period of time when their body does not show any symptoms and will even have normal blood glucose levels without the need to use any medications. Although their blood glucose levels are normal, it doesn't mean that there are no changes happening within their bodies. Even when symptoms may not show in type 1 diabetes, the immune system is still attacking the remaining islet cells in the body, making the pancreas lose its ability to make insulin. The patient will progressively need to increase their insulin injections and ultimately be totally dependent on insulin. To learn more about type 1 diabetes, you can go to diabetes.org, which is run by the American Diabetes Association. It provides plenty of information and resources you can refer to. Another website you can go to for more information and support if you have diabetes yourself is jdrf.org. GDRF is a global organization that helps fund for type 1 diabetes research and provides diabetes support. I recommend checking both of these sites out. I hope this video on type 1 diabetes was informative for you. Thank you for watching.